So today we have Dr. Michelle Jorgensen on. She actually did my cavitation surgery about 3 years ago. And she is an author, speaker, teacher, biological and holistic dentist, and founder of Total Care Dental. And just became a board certified naturopath. She founded Total Care Dental in 2001 and has helped over 20,000 patients since. So, Dr. Jorgensen. So I wanted to start out by talking about what are the main dental issues that you see that need to be resolved, especially with people with chronic health, that improves that.
Mm-hmm. If it's okay, I'm actually going to start a bit with my story because I think it leads into that a little bit.
Yeah.
Like you'd said, I've been a dentist for a long time and had been practicing for about 10 years, a decade or so, and was having major chronic health problems myself. And I didn't know what it was from. I didn't know really where to even start. So I started the way everybody started. Mm-hmm. I started going to doctors, getting testing, MRIs, all these things, and really came up with no answers.
Yeah.
And what I found is that's the story that a lot of my patients have too. A lot, chronic health problems, going to a lot of doctors, seeing a lot of different practitioners, having tests done one after another, and not a lot of answers.
Yeah.
And that's exactly what I experienced. Not a lot of answers until finally I've had someone say, this might be Mercury.
Mm-hmm.
And I got tested for that finally. Mm-hmm. And that's what I found out it was Mercury. So for my patients, the three things that I really see are, number one, mercury, the same thing that was my problem, which can also be metals in general. So it's metals which are in crowns. It can be metals that are in dental implants. It can be metals that are in retainers. A lot of people have metal retainers, don't even think about the fact that they're metal.
Yep.
And then obviously those mercury fillings. So that's a big one. That's one of the three biggies.
Yeah.
The second big one that we see every single day, all day long, is infection. So that was your story with cavitations. And we'll talk about, I think later, about exactly what those are. But infection that's hidden. And people will say, oh, I don't have a toothache or nothing hurts, but it probably didn't for you either.
No.
So these things don't hurt.
Yeah.
You think infection hurts, but they don't. So it's hidden infection is what I like to call it, is the second biggie. And then the third one is sleep issues. And people don't think that a dentist should be looking for that, talking about it, treating it, any of those kinds of things. Mm-hmm. But it may be the biggest of all three of those. So it's really interesting every single day to look at those three things when we look at people and talk about how could any one of those three, or sometimes all of those three, be influencing their health.
So what do you mean by sleep issues?
So the questions I ask people to identify, is this a problem, is, can you go to sleep? Mm-hmm. Can you stay asleep? Mm-hmm. And do you feel rested when you wake up in the morning? Mm-hmm. Those are the things that people look for. There's other signs and symptoms too, like do you toss and turn a lot? Do you wake up in the night to go to the bathroom? Does your bed look like a tornado hit it when you wake up in the morning?
Yeah.
A lot of those things. Do you grind or clench your teeth at night? All of those mean that you are struggling to get air. And so we actually look in the mouth and see, is there a structural problem that's leading to that? And then how can we actually correct the structural problem to help people really, in essence, regain their life and get back to sleeping and resting and healing again?
That's really cool. I might have that.
You're like, wait a minute.
I'm like, wait a second.
This sounds really familiar.
So what do you do for that? Is it like deviated septum type stuff, or?
It depends. Sometimes it's a deviated septum. And in fact, it's fun to look at our CT scans. We take CT scans on every new patient for multiple reasons, but I can see all those hidden infections. I can see all the head and neck issues, including these airway problems. So I can look at your nose. I can see, can you actually breathe through your nose? And if not, we work with ENTs to take care of that. But there's often, first of all, swelling from those infections that can cause blockage in the back of the throat. But a lot of times, and this really has to do with the world that we live in today, the nutrition we have, the environmental toxins, the allergies a lot of us are showing up with, it leads to the growth of a very narrow upper jaw. And when the upper jaw is very narrow, everything doesn't fit. So everything has to just be squished into a small space.
Yeah.
So we actually work to expand that upper jaw back out where it should be, even in an adult.
Interesting.
Yep. So we undo what happened or didn't happen correctly during growth and development.
Oh, cool.
Yeah.
So with cavitations, do you want to tell everybody what a cavitation is? Because I feel like people just don't even know those exist.
Yeah. So let's go into both of the hidden infection categories.
Okay.
So the first category that I look for is always root canals. And the reason I look for them is simply an anatomic problem with the tooth. The tooth itself has a channel in the inside, or a canal, which is the reason for the word root canal. There's a canal on the inside of each tooth. That's where the blood vessels live. That's where the nerves live. So the blood vessels carry all the nutrients from the body into the tooth and keep the tooth healthy and alive. Well, when a root canal is necessary, what happens is that canal area has either had a cavity gotten and infected the nerve, or it's been broken, or something has happened, and that blood vessel nerve area is dying or is already dead. Well, the other thing that happens inside of that canal is there's little tiny side channels that go off, literally a mile of little side channels in every single tooth. So when that canal or that nerve tissue is dead inside of the canal, that's what a root canal is you go in, you clean out that dead tissue, fill it all up. But it's impossible to clean that mile of little teeny microscopic tubules inside of the tooth.
Okay.
So if the tooth's already infected before the root canal procedure is done, those bacteria have invaded all those little side channels long ago. And there's no way to clean them, no way to fill it, no way to take care of that. So it requires the body to always be fighting a low-grade infection inside of the tooth. And the immune system's gone because the blood vessels are gone in the tooth. There's no way that the body can get in there and take care of this either. So what happens is you get a new infection all around the outside of the tooth, and you can't feel it. The nerve's gone. There's no sensation. But it is incredibly destructive. And what happens, I tell people it's like a blister at the bottom of your foot. Every time you step on it, you're stepping into the blister. Same thing happens with these infections at the end of roots. Every time you chew, you're basically pushing on that blister and spreading the infection throughout the entire bloodstream of the body.
Oh my gosh.
So every time you chew, you know, it's spreading everywhere. So these infections affect everything. And it's been really interesting. Just lately, I've been trying to quantify this, but I've yet to find a patient who had a chronic disease, particularly something like heart disease, cancer, the big guys, that doesn't have a failed root canal or a cavitation that we're going to explain now somewhere in their mouth.
Wow.
So it's pretty much 1-to-1. So the second piece is cavitation. What is that? There's actually cavitations in other places in the body too. A cavitation is, if you think about what is the definition of a cavity, it's a hole. In something, you know, if there's a cavity in a rock, it means there's a hole in the rock, right? So that's the word, that's what the word means, is a hole or an area that didn't fill in, that's not filled in. So when a tooth is removed, the bone should naturally fill in the space again. It should be healed within 6 months at the latest, really even a lot of times 3 months or so, that bone's pretty well filled in. In order for the bone to fill in, there needs to be nothing in the way of healing. Well, when a tooth is taken out, sometimes we leave things behind. Sometimes the ligament that's surrounding the tooth gets left behind. It doesn't just naturally come with the tooth. Sometimes little fragments of the tooth get left behind. There's other things that get left behind. Sometimes if we're taking out an old root canal tooth, some of the filling material that was from the root canal gets left behind. If something gets left behind, the body cannot completely fill and heal that hole. So what's left is a hole in the bone, and it has garbage in it. Like, think of it just as a pile of garbage inside the hole. Well, bugs love garbage. Anytime you have a pile of garbage, you know, you think about a pile of garbage at your house and inside your yard, it's gonna get bugs in it really fast. Same thing happens in our body. If we have anything dead that's not healthy in the body, bugs, meaning bacteria, viruses, fungus, parasite, they're gonna find it. And they're gonna go and have a little party.
What's the weirdest things you found in cavitations? Have you found parasites and stuff?
Oh yeah, yeah. We biopsy parasites probably weekly out of there.
Oh my gosh.
So, yep, it's just a place that everybody goes, that all the bad guys go because they know it's a safe place. You're not going to get in there, you know, and get it out. So they go and they have a little party. And then that party is what really takes you down, because your body's immune system is kind of like the police force of your body. You know, somebody's having an all-nighter party every single night, and the police force has to go out every single night and try to calm the partiers down, you know? And so your own police force is having to fight it constantly, and eventually your police force is just like, I am so done with these parties, you know? And now it can't deal with any other parties that are going on in the rest of your body because it's dealing with this party all the time. So then people have other problems that crop up because the immune system's just too busy fighting this.
Yeah. So why do you think, I'm sure you know, why is there no pain sometimes associated with that?
Because bone actually doesn't have nerve. It's the interesting thing.
Yeah.
So skin has nerves, ligament has nerves, cartilage, all these things have nerves, but bone actually isn't innervated.
Yeah.
So you don't feel it. It doesn't hurt.
So how do you find them? You do a CT scan?
Yep, exactly. That's the only way that is a definitive way to find it, is you on a CT scan. When I'm saying CT scan, it's a specific dental CT scan called a cone beam scan. So it's not the one that you go to the hospital and you get, and people are often very worried about that. They're like, oh, aren't you worried about the radiation? All those kinds of things.
Yeah.
Significantly less radiation than anything you're going to get at the hospital.
Got it.
Dental specific CT scan, and on that, the one I have in particular, it has a measurement on the scan itself that shows bone density. So I can roll right over each of these areas and it'll give me a measurement, just tell me how dense is the bone. It can't tell me, is there a parasite in there? Because this is an x-ray. But it can tell me, is there bone there?
Yeah.
That's what I'm looking for.
Yeah.
Because bone should have healed within 6 months of a tooth coming out. And if there's no bone in that area, there has to be a reason that it didn't heal. So we're looking for the lack of bone, and then we go into the actual area and find the reason.
Got it. So I think the way you guys heal it is very interesting. Do you want to tell how you help the body regrow the bone there?
And there's some doctors that just choose to treat this with laser. They'll shine a laser at the area and hope that it initiates the healing response. But my understanding and my literal physical, when I look inside of these and see what I see, I know that this is a physical problem, meaning there's garbage in the hole.
Yeah.
So if all I do is shine a laser on the hole, it's not going to clean the garbage out. So the body may kickstart some healing, but it's not going to fix the problem. And in my experience, it's going to come back. So we actually have to go back in. We like to think of it like a pumpkin. So you remove the lid and take it out, and then you remove all the inside gunk out of the inside of the pumpkin, clean it all out really well.
Yeah.
And we use ozone. So people often will say, what in the world is ozone? And actually, just this week, there was an article put out by Colgate. I don't tell people to use Colgate toothpaste usually, but I was impressed that Colgate was talking about ozone because it made me excited that, this is getting closer to mainstream. Yeah. So people are realizing that this is a good thing.
Yeah.
I was super excited to see Colgate talking about ozone. But what ozone is just 3 molecules of oxygen. And I like to think of it like if you're on a date with somebody, 2's great, 3's a crowd, right? Same thing with oxygen. 2's great. That's what we breathe. O2. 3's a crowd. So the third guy is looking for somebody to go on a date with. So that third molecule of oxygen goes and binds with every bug. It binds with bacteria, viruses, parasite, doesn't matter what it is, and it kills it when it binds to it. So that ozone is the thing that's actually getting deep into the cavities, deep into the bone, because we can't necessarily go in and physically clean out way wherever that infection spread. We don't even know it.
Yeah.
So the ozone will do that job. It'll burrow its way down in and clean everything out really, really nicely.
Yeah, I remember when you guys did mine, I had 4, and you put the ozone in, and I felt it all the way, up here. And I was like, whoa, it went everywhere.
Because that's how far the infection had spread.
Yeah.
And there's no way I could go up in there and clean that out. So that's the cool part about ozone, is it's going to go where I can't go.
Yeah.
So that's cool. And then now we have a hole, it's a clean hole, but it's still a hole. So we put something called PRF, which is from your blood. So we do a small blood draw. And we draw your own blood, spin it and prepare it a certain way, and it pulls out the stem cells, the growth factors, something called the fibrin, which is kind of like a mesh network that holds all the good stuff together. And we actually put that back in the hole, and that acts like a scaffolding for your bone then to grow to. And if you know what a stem cell does, wherever a stem cell is put, a stem cell is a precursor to all cells, meaning every cell started as a stem cell, and then when it went somewhere, it said, oh, I need to grow a fingernail because I'm in the fingernail place. That's what a stem cell does. So wherever you put it, it will grow the thing that's supposed to be there. So when we put stem cells in bone, it'll grow bone. So that's the cool part about the PRF, is it kickstarts the healing process. It doesn't rely just on the body itself to do it. We actually give it the tools to be able to regrow that bone.
That's awesome. So if you don't repair those cavitations, what can happen to your body?
A lot of times it's what's happened to your body up until that time, too.
Yeah.
So it's interesting. The body works on an electrical grid. You know, our homes, our cities are all on electrical grid, and we all worried about grid down, what's going to happen if, all the electricity goes out.
Yeah.
Well, when all the electricity in the body goes out, that means we're dead.
Yeah.
So our body has an electrical grid as well, and each of those grid points is connected to different organ systems, just like my home is connected to a different power plant or a different system than yours is.
Yeah.
Well, the areas where wisdom teeth came out in particular are connected to the grid that also includes the heart, the endocrine system, so that shows up with thyroid problems, fatigue issues. It also is joints, and a lot of times people will have hip pain and knee pain associated with this. And you think, what? It's just because it's on the same grid system. It's on the electrical grid with the rest of the body, with those parts. So we see a lot of people with fatigue and unexplained fatigue. Like, I just can't figure out why I'm always tired.
Yeah.
You're burning your thyroid out. How many women especially do you know that have thyroid problems today? And then heart is a big one. When people have heart problems, blood pressure issues, those kinds of things, and that's one that I'll see over the long term. Like, this is just slowly creeping up. Your blood pressure slowly creeping up. The stress on your heart slowly creeping up. You can't really feel it, but it's showing up as, boy, I get out of breath a lot, or I don't feel like I'm as fit as I used to be, or I'm just not thinking clearly anymore.
And is that because the infection is just kind of dripping down? Because do you have blood vessels in your jaw?
Blood vessels in your jaw. And again, it's that electrical grid system. So it's connected with all of those rest of the system. So if there's a short here, something that's not working right here, it will short everything else that's connected as well.
Got it. Okay. Yeah, I remember I used to get really puffy, like, lymph nodes all the time, and now I don't get that anymore.
Yeah, because the lymph system is your sewer system.
Yeah.
So it was draining all the garbage that the party goers were dropping on the ground and draining it out all the time. So it was always swollen, but now there's no garbage to drain.
Yeah. So is there anything else you think people should know about cavitations?
As far as cavitations, where can they happen? The most common place is wisdom teeth areas, and it's just the most common place, I believe. Well, there's two reasons, I believe. Because it's the most commonly removed tooth. So that one's the one that makes sense, you know. But the second is, think about when we often have those wisdom teeth removed. So when we're late teens, right? Late teens. Is our nutrition at its finest at our late teens?
No.
Are we still growing in our late teen area?
Yeah.
So our bodies are still requiring a lot of nutrients to grow. Are we sleeping well? Is our stress level like? What's our hormones like? To me, it's the worst time in the world to put 4 holes in your head.
Yeah.
Because you're the least likely to heal from that at that point in life. And that's the time we do it.
Yeah.
So your body just doesn't have the resources it needs to fight what's going on there during that time of life. So that's why I think it's the most common place. But you can get a cavitation anywhere. Any tooth that's been removed, you can get a cavitation in that spot. And remember, cavitation is just a hole that didn't fill in.
Yeah. My husband, you guys are fixing 4 of his right now. From root canals. So.
Yes, exactly. So then let's talk a little bit about root canals. What do you do if they're infected? That's the tricky part, because like we explained, all of those little tiny microscopic channels, even if you redo a root canal that's had a new infection at the end, there's no way to clean those microscopic channels. So as long as the root is there, as long as the tooth is there, the infection potential is there.
Yeah.
That's the part that's the hardest. And I have to tell people this. I have multiple people every day that I have to say, you know what? I really believe for long-term health of your mouth and your body that we need to remove and replace this tooth.
Yeah.
And it used to be that I'd tell everybody, you know what, I will save your tooth at any cost. And now I've changed my tune. Now I say I will save your health at any cost, even if it means removing a tooth to do it. Because it's not worth it.
Yeah.
You can live without a tooth. Yeah. But you can't live with chronic health conditions that are going to take you down. So
for sure. Yeah. So Mercury, what did you see in yourself? We talked a little bit about this, and what do you see in others, and kind of what do you have to do to remove that?
Good questions. So mercury is the most neurotoxic, non-radioactive element on the planet. That's by definition. So neurotoxic means it's going to affect the nerves. So some of my symptoms were brain fog, like significant. And I've always had a really good memory. If I read something, I know it forever. I stopped knowing anything. My brain just stopped working. And that was very unusual.
Yeah.
I was in my mid-30s, you know, it should not have been happening.
Yeah, for sure.
So I knew something was significantly wrong. So again, it's brain, nerves, right? The other thing that happened is I had really, really bad numbness, especially in my hands, especially my right hand. So nerves, again. So if people really, suffer from neuralgias or numbness, mercury is a likely problem. The other thing it did is mercury actually interferes with zinc absorption, and zinc creates stomach acid. So my stomach stopped working. I stopped absorbing food. I stopped digesting food. I felt horrid. So that's really the first thing I started trying to fix was my stomach. Like everybody seems that's where you start. You're like, let's fix my gut first.
Yeah.
So I started trying everything that everybody told me to do, and it wasn't working. So I thought, gosh, it's not working. It's supposed to be working.
Yeah.
Well, it's because something was interfering with my stomach actually making the acid it needed to digest food. When I fixed the mercury problem, that problem went away.
Interesting. So did you have to detox after you got the mercury fillings out?
I didn't have any mercury fillings.
Oh, it was just from doing them all the time.
That's why I was so suspect, because that's why I never thought about it, that it could be a possibility for me.
Wow.
Yeah, because as a dentist, and I was a cosmetic dentist, I spent 10 years just making smiles look gorgeous.
Yeah.
And usually people want those black fillings out if they want their smile looking better. Yeah. So I was drilling probably 20 out a day and had no clue, the profession does not talk about this, that when I touch a tooth and I drill out that filling, what it's doing is it's actually creating vapor, mercury vapor. It's vaporizing the mercury in that process. Wow. The mercury vapor, my head's here, their head's here. Guess where the vapor's coming? Coming straight up into my face.
Oh, man.
For 10 years.
Yeah.
So that was my problem. So the problem was, this is why I converted my practice, because I couldn't keep doing my job.
Yeah.
If I was going to get better.
Yeah.
The doctor said, and so I actually had my practice for sale. Because the doctor said, you can't keep doing your job unless you figure out a way to do this without getting that mercury in you. Because you can't dump it. Because I had to do a massive detox. In fact, I think the detox took about 8 years, really. Wow. From start to finish before I really went, I think my brain's back again. Woohoo! Woohoo! It's back! Yay! But it took a long time. So I couldn't keep breathing it in while trying to dump it out. It would never gain ground. I would never get there. Yeah. So what I found is there's an organization who's actually been studying this and creating protocol for this for years. Just nobody talks about it in dentistry. So no dentists know. And now there's more, but still it's a pretty small number. Yeah. But there's specific protocol that you do. So this is for patients and for practitioners alike. So from a patient standpoint, when you're getting them removed, the worst thing you could do is to get it removed and have it done unsafely. Because now you're going to what mercury does is it just moves around to a new neighborhood. So it might be living in this neighborhood, but now it's just going to move to your kidneys once you get it out and you swallow it and you breathe it all in. Yeah. So it's just going to move to a new neighborhood. You don't want it to do that. You want to kick it out entirely. Yeah. So that mercury, you have to try to minimize the amount that you're getting in. So when we remove it with patients, what we do is we have a nose covering. It has oxygen coming through it, so you're not breathing. Yeah. But it's covering it so you're breathing only that oxygen and not the vapor in the air. Yeah. We have a special dam that we use inside of the mouth that keeps it from you swallowing it. We have a gigantic vacuum that goes right here at the base of the chin that sucks it all that direction instead of up. We cover your body because mercury is absorbed through the skin. Yeah. So we cover you from head to toe. And that is for the patient, for the practitioner. There's a special mask that we wear that helps keep it out of our system as well. We have special ventilation that we use to try to get it, exit it from the building quickly. All of those things are really important. If anybody that's watching this wants to get mercury fillings removed, don't do it unless you're going to do it safely, because you're going to get more. Yeah.
So now let's talk about sleep. So what are the issues you see with that, and how is that resolved?
The three biggies that I see are people not being able to go to sleep, just tossing and turning, insomnia. The second is not being able to stay asleep. And it's interesting because a lot of people will say, I just get up to go to the bathroom. But there's an interesting thing here. There's actually a hormone in the body that's produced when we sleep that turns off the urge to go to the bathroom.
Really?
Yes. So if you're waking up to go to the bathroom, it's for one of two reasons. Number one, if you're not getting enough oxygen, it actually creates a lot of what's called ammonia in the body instead. And that ammonia is very irritating to the bladder. So it will just annoy it so much that it will wake you up to go to the bathroom.
That happens to me.
There we go. Yeah. Or number two, if you're not deep sleep, then you're kind of lightly awake and you kind of wake up and you go, I might as well go to the bathroom because I'm awake. You know, so you should not be waking up to go to the bathroom at night. If you are, you have a sleep problem.
Interesting.
The third is, I feel like I sleep okay, but I'm never rested. I am exhausted all day long, no matter how long I sleep. So those are the three big ones that I hear. So the first thing we look at is say, okay, is there actually, well, first of all, are you getting enough oxygen? So we have ways to test that really simply. We look in the back of the throat. We say, okay, is there room for air to get through? We test your oxygen levels while you're laying down. Say, okay, what are you even getting, you know, awake? There's a whole bunch of signs that we look for. If you have flat, worn teeth on the front, this is a sign that you're struggling to get air. If you get muscles sore at all, especially when you wake up in the morning, if you're grinding or clenching your teeth, any of those things are signs that you're not sleeping very well. So we look for all of that. If you toss and turn, you know, any of those things we look for. Those are all signs that you are struggling to get enough air because air is life-sustaining. So if you don't get oxygen, you will die.
So I feel like most people, they just give them a CPAP for that, right?
You got it.
So what can you do differently?
So what a CPAP is, first of all, it's a spouse that you didn't intend to marry. Okay. You're now married to this thing
Sleeping on
for
your
the rest
face
of
all
your
night.
the rest of your forever.
Yep.
Did you want to marry that spouse? Probably not. Okay. So that's one problem with CPAP. Second problem with CPAP is it's actually forcing air down the throat, forcing air down the pipes, I call it. When you force in extra air, it turns off the body's natural urge to breathe because it breathes when it's low on oxygen. Does that make sense? It works to get more air when it's low on oxygen. When you're forcing air in, it shuts that need off. So it actually turns off your body's own ability or desire to get breath.
Interesting.
Yeah, it counteracts a little bit what you want. So you are now dependent on this completely.
Wow.
Because it's breathing for you in essence. You know, it's giving you the air you need. But your body stopped really seeking for it because it doesn't need to seek for it anymore.
Yeah.
So those are two big problems with CPAP. You're married to it forever. So what we do instead is we say, why are you not getting the air you need? What's in the way? Can your nose not get the air through that it should? Is there, let me give you this example. Well, actually, let me back up a little bit developmentally. So if you have a small child, baby, that has a tongue tie. A tongue tie means simply that the tongue has a really tight band of tissue underneath it that's holding it down to the floor of the mouth. A baby should put a tongue up to the roof of the mouth, and that's how it sucks. It pushes against a nipple or a bottle, and that's how the sucking motion happens. If the tongue can't go up, the tongue comes forward and instead sucks out here. This is why you get a cranky baby, a colicky baby, because they're not getting enough milk.
Yeah.
It also doesn't do the action that the tongue should do, which is that force of the tongue against the roof of the mouth should expand the roof of the mouth out and form the roof of the mouth. If it couldn't go up and do that, the roof forms very narrow.
Yeah.
So I like to think of the back of the throat like a curtain rod. If you've got a really short curtain rod, all the curtain's going to be bunched up and hanging down really low.
Yeah.
The air can't get by it.
Yeah.
But if the curtain rod is wider, if the palate is wider, the roof of the mouth is wider, the curtain rod stretches out, the curtain pulls up, and everything stretches out, and you can breathe past it. Does that make sense?
Yeah.
So the narrower the jaw, the upper jaw is, the narrower the bottom jaw will be because it follows, but then the more has to fit inside a really squished space. So you'll see a crease down the center of the tongue. You'll see what we call scalloping on the sides of the tongue. It's the tongue trying to fit, and it can't quite fit in the mouth. So we actually have an appliance. When I say appliance, people think like crazy headgear. That's not what I'm talking about. It is a retainer-like device. So it goes inside the mouth, and over time, it works to expand the upper jaw back where it should be. So you expand that upper jaw back out, the curtain rod lengthens out, the curtain comes up, and the air is able to pass through again. So now, no longer married to anybody you don't want to be married to, and this is a permanent fix rather than just a temporary Band-Aid like the CPAP.
Wow. So is that the main thing you guys do for that?
There's a few things, but that's one of them, yes, is expanding that upper jaw. We also have a laser treatment that shrinks that tissue, shrinks the curtain back there to make it come up higher so that you can get air past. Sometimes we have to do a little bit of both.
Yeah.
Yep.
Wow. That's awesome. My sister is actually a dentist who does the surgeries for
Awesome,
people.
awesome. And kids, this is why it's so important. We just opened our Total Care Kids department because it's so important to catch this before this has happened in a child.
Yeah.
So we do lip and tongue tie releases now here.
Yeah.
We do this, we call it interceptive appliance work with children. So we can help direct the growth of that upper jaw so they never have to have these problems as an adult.
Oh, that's awesome.
Yep. So we intercept their growth and use their growth to make sure they're growing the correct way.
And both of my kids had tongue ties.
Yep.
So I get it.
Yep. It all goes down to what is a tooth made of, and what is a cavity really.
Yeah.
So a tooth, the outside of a tooth is made of minerals. And what a cavity is, again, we've used the word cavity a couple of times in this conversation. Cavity is a hole,
Yeah.
and a cavity in a tooth is a hole in a tooth. So it's when the minerals are dissolved or removed from the tooth, and there's a hole left behind, and then bacteria crawl into that hole. And then they have some dinner, and then they have their garbage, and then that dissolves more minerals, and the minerals go away, and the bacteria crawls deeper in the hole. That's all a cavity is bugs crawling into a hole in your tooth. So the concept that you have to understand is if it's minerals that are lost that cause the hole, well then if you put minerals back, it should fill the hole back up again. So the question is how deep is the cavity? How deep has that bacteria crawled inside of the tooth? If it's still in the outside layer, which is the enamel, it's the part you see right here, that's full of minerals, if the cavity is still there, we can get rid of the bacteria and you can add minerals, lots of minerals, and you can heal that cavity. Awesome. If it's deeper in the tooth, if it's into that place where all those little tubes are, that's like a superhighway, and the bacteria have now jumped into that superhighway, and they are everywhere.
Yeah.
That's when you need a dental intervention. You need a dentist to come in and clean out the bugs, fill it back up again, but as long as it's in that outside layer, you absolutely can heal or regrow the outside of that tooth, remineralize it. That's the best word.
So how do you mineralize it?
So a couple of things. That's the reason I talked about the nutrition piece. The fat-soluble vitamins are the ones that are most important to help deposit minerals in your teeth. So that's the vitamins A, D, E, and K. Vitamin D and vitamin K2 are the most important ones for that. And they're often through foods like butter. So people never mind when you tell them to eat more butter.
Like, cool.
Butter is a great source for these foods, so that's a great way to do it. But there are also products. So this brings up another controversial topic, which is fluoride. Fluoride is often the thing that people use to remineralize the teeth, but it doesn't make any sense because teeth don't have fluoride naturally in them. Teeth have minerals in them. So why would we add something to the tooth that it didn't lose? Fluoride will harden the crystal of a tooth, but it will not regrow the crystal of that tooth. So I don't want to add something that never was there. I want to add something that it lost. And the word is called hydroxyapatite. It's a big word, but you're going to see it in products. You want a product that has hydroxyapatite in it.
Okay.
That is the mineral in the tooth. So you can get powders that have that you put directly on the teeth. You can get pastes that have that you can put on the teeth when you're brushing. You just want something that is putting minerals back into the area of the tooth that has had minerals lost from the tooth. There was a dentist in the 1930s named Dr. Weston Price. And Dr. Price was really dismayed because he saw cavities rising in children. There were more and more cavities, and even though people knew more what to do to prevent it and they had more products to brush and all these things, nothing was getting better. So he decided he wanted to go and study societies all over the world. What did they eat and what did their teeth look like?
Yeah.
So the cool thing is there were still societies that had not been touched by the modern American diet, the standard American diet. They were still eating their indigenous food that they had been eating for centuries prior to that. He also had a camera, which is pretty cool because he could take pictures of what he found.
Yeah.
So what he did is he went and cataloged all of these societies and he said, what do they eat? And what does their mouth, their jaws, and their overall health, what is it like? And what he found is the societies that had the best health ate, these were his findings, 4 times the amount of water-soluble vitamins, which is vitamin B and vitamin C, 10 times the amount of fat-soluble vitamins, which is A, D, E, and K. So if you're getting a lot of cavities, if people are seeing a lot of cavities, it usually means they're not absorbing nutrients. They're not either eating nutrients, that could be the starting point, or they're not absorbing nutrients. So that is a big one that we can identify. And that's the cool thing about dentistry is I can't see your bones. I can't see your intestines. I can't see your brain. I can't see those things, but I can see your teeth. I can see
Yeah.
your tongue. I can see your gums.
Yeah.
And those are reflections. The teeth are reflections of the bones. The gums are reflections of the GI, the entire GI system.
Yeah.
You know, all of these things give us signs about what's happening. And so the dentist actually is on the front lines of healthcare, should be.
Yeah.
We don't take that role nearly often enough,
Yeah.
but should be, because we can identify things that are going on in the rest of you often before you even know what's going on in the rest of you.
Yeah.
So it's pretty cool actually what dentistry can do. And, you know, just to give people a little insight, I am the last to slam dentists or dentistry, because I am one. And I was a traditional dentist for 10 years.
Yeah.
We don't know either.
Yeah.
The dental profession doesn't know either. So what I am all about is educating all of you, because if you know more, then you're going to go ask more from your provider, from your practitioner. And if they don't know, then you'll go find somebody who does. And eventually enough dentists realize there's a lot of people asking for this. Maybe I should go and get some education myself and learn too, because they just don't know. They don't know. They're not doing it wrong or anything else because they are intentionally not doing what they should. It's just simply a lack of knowledge. So people need to ask it.
Yeah. So let's say if somebody had like the best dental routine, they brushed their teeth, they flossed, they did all of the things, but their teeth were still really struggling, what would you say to that person?
Gut. 100% gut. Probably gut health.
Yeah. Just not absorbing or
Yep.
not enough good bacteria.
All the above. And you know, there's so much information about gut health, but that's a huge one, is to find out, are you actually absorbing food?
Yeah. And how do you find that out?
My favorite way is we call the baking soda test. So you take a 1/4 teaspoon of baking soda in a cup of water, you drink it, and you see how long it takes you to burp. And
I've read about that one.
And what that does is it's the baking soda reacting with the stomach acid. And if you don't burp, it means you don't have enough stomach acid. Stomach acid is the thing that enables you to absorb nutrients. So if you're not burping in 2 to 3 minutes, that's how long you should burp, 2 to 3 minutes. If you're not burping in 2 to 3 minutes, it means you have too little stomach acid. And that's where we start. So, all right, let's supplement stomach acid temporarily right now while we figure out why do you not have stomach acid. And there's all sorts of reasons. Remember, Mercury was one of them. Not sleeping is one of them because it pushes you into fight or flight mechanism and into fight or flight mode. So that's another reason. There's a lot of stress pieces that relate to not getting enough stomach acid. There's also pieces related to the food you're eating itself. You know, is it able to stimulate stomach acid? Are you eating any food that's actually alive?
Yeah.
Because then that helps you actually absorb other food too. So there's a lot. But yes, if your teeth are still struggling and you're doing everything right, everything you've been told to do, which is brush your teeth, floss your teeth, you know, you're doing everything right, then this is past what you're doing here and it's onto what you're doing here.
Yeah.
Yeah.
Very interesting. Well, is there anything else that you want to share before we...
I think that covers the biggies.
Awesome. Well, thank you so much for hopping on and educating everybody.
Thank you for allowing me to share.
Yeah.